Doesn't everyone just receive high quality care in Australia? We've got this fantastic healthcare system. Is everyone receiving their healthcare that they deserve? The stark reality though is that, according to Australian Institute of Health and Welfare data, is that nearly 20% of Aboriginal and Torres Strait Islander people don't seek healthcare because of racial discrimination. And I know it's been a big focus of AHPRA that we need to eliminate racism from healthcare.
There is an expectation in Australia that all health practitioners, especially the regulated ones, are culturally safe. I think what's really important is that we understand what that really means.
It's expected that all healthcare practitioners in Australia can demonstrate how they're responsive to the cultural needs of First Nations communities and patients. And so as an accreditation authority, we're making sure through our work that the physiotherapy graduates are going to be on that journey of becoming a culturally responsive physiotherapist.
The work the Council's done around reconciliation as it applies to accreditation has been quite significant. It started a few years ago where we brought Aboriginal and Torres Strait Islander members onto our accreditation committee, and they challenged us deeply around how we might challenge the system when it comes to reconciliation. The first step was getting people around the table, people with lived experience.
So the Australian Physio Council has been really modelling best practice through the accreditation work and what is possible and what can be done. And as a result, the Council have attracted over 15 First Nations staff to work on accreditation panels and developed a reputation in community and within the physio network of its commitment to cultural safety and cultural capability. And that reputation has, I guess, gone further because institutions and universities know that that is a firm commitment that the APC has made and that their curriculum needs to reflect that.
You know, it's really important for me as an accreditor to see that cultural safety, Aboriginal and Torres Strait Islander focused content is integrated into a course throughout the body and length and breadth of the course in a way which is integrated and scaffolded throughout the course.
Cultural safety is a journey, and I'll continue to say it's a journey because it's a lifelong journey. As you grow, we develop more and more skills and knowledges to be able to work with patients in different aspects. So being a student, it's really the start of their journey as they're coming out of that program and going into becoming a health professional.
We support universities as well to make sure that we're developing practitioners in ways that would be much more culturally responsive, and also as people coming into our country to make sure that they're aware of the landscape as well and the unique needs that First Nations people have in this country.
One of the really valuable pieces of work that the Australian Physio Council has done is the development of the cultural safety training module that they've developed, which in fact has become a bit of an industry standard, to be honest. It's been used across other disciplines and in other areas.
So we believe that the cultural safety training program is going to help an international physiotherapist actually become a culturally responsive practitioner here in the Australian context. And so they start their learning journey of what that means. And as a registered physiotherapist here in Australia, then they can demonstrate what all physiotherapists need to here in Australia.
I think physios play an incredibly important role in reconciliation. They are frontline health practitioners and they are engaging with communities all across this country, and they need to be safe when they do that. In order for them to deliver great services, they need to understand the importance of what cultural safety brings.
Before legislative change, the Council made a commitment to cultural safety, and so really demonstrating leadership in the space, and that leadership has huge impact on workforce development and eventually systemic change.